Hi, everyone. Thank you for joining us today. We have some more people coming on, so I'm just going to give them a couple more minutes to sign on, and then we'll get started on today's webinar. All right. Hey, everyone. Again, thank you so much for joining us today. I have two Daijiro College of Pharmacy students who will be doing a presentation on mental health and the effects that the COVID-19 pandemic has had on it. It is my pleasure to introduce Nooeree and Daijiro, two of our students at DKICP who will soon be going out into rotations. So anyway, without further ado, I'll hand it off to Nooeree and Daijiro.
All right, thank you. Hello, everyone. Nooeree and I will be discussing our mental health during the COVID-19 pandemic. This is an outline of our presentation. We will be going over, we will be talking about increasing rates of anxiety, depression during the pandemic, how COVID affected everyone, mental health risk factors, recognizing when to get help, mental health self-care solutions, and mental health resources. With the decrease in in-person socializations, many individuals struggled with loneliness and isolation. Being disconnected from family and friends has led to negative psychological consequences such as anxiety, depression, and frustration. The daily lives of many have been disrupted, which has caused a lot of distress. The mental health impacts of COVID has been affecting various groups in the population, such as seen in children and adolescents. The short and or long-term effects of the youth's mental health has been from anxiety, distress, social isolation, and possibly living in an abusive environment. Solutions to misbehaving children requires parents to calmly handle and focus their attention to their children's needs. As the older adults are healthy, they are susceptible to contracting COVID, so it is vital for them to distance themselves. The disabled that depend on others for their daily routines are struggling the most. They have to decide on risking their health, and it is hard to get the help they need. Among essential workers, such as doctors, nurses, and paramedics working on the front lines, they are forced to fight the pandemic, and so the virus is causing them to experience at least one adverse impact on their mental health and well-being, such as difficulty sleeping or eating. Other essential workers have reported burnout caused by increased workloads, understaffing, stress associated with fears over coronavirus, and struggles in enforcing social distancing. Individuals released from quarantine experience stigmatization and become emotionally imbalanced because of the global health emergency. Mental illness has and affected everyone by making it challenging to live a normal daily life. They can not only affect the individual, but the burden of mental illness can cause a ripple effect by affecting everyone around them. It has been reported that anxiety and depression rank as one of the top and leading mental health issues people are struggling with. This state of mind can occur not only during this pandemic, but also in any situations of uncertainty, from taking an exam or going to a doctor's appointment. In the US alone, the rate of people struggling with mental health has been increasing from 33% in June to 42% in December. Here in Hawaii, the impact of the pandemic caused 37% of adults to have symptoms of anxiety disorder and about 30% of adults to have symptoms of depressive disorder. This significant increase from last year's 8.2 and 6.6% rate shows how much the pandemic has impacted us locally. With that, an increase of alcohol and e-cigs were observed during the pandemic as well. Mental health can also be a risk factor for COVID because it can increase your chances of complications from COVID-19. Moreover, interestingly, mental health issues such as having anxiety or fear-related disorders has led to increased prevalence of death from COVID-19. The reasons may be due to these several factors, such as including the immune system being compromised due to the amount of stress, medications used to treat mental health conditions. Some psychiatric medications increases the risk of COVID-19 complications because their side effects are detrimental to the immune system. And medical care is limited as many hospitals are overwhelmed with COVID cases. Now, Nooeree will be discussing recognizing when to get help, mental health self-care solutions, and mental health resources.
So, recognize when to get help. It is completely normal to feel some psychological and physical reactions, especially in these times of the pandemic. But it starts to become a concern when these signs and symptoms last for several days in a row, make you miserable, and cause problems in your day-to-day life. When it comes to this point, it is time to ask for help. Lifting depression and anxiety without a prescription. Maybe you're having some concerns, but don't feel as though you've hit the point of asking for help. Here are some things you can try on your own to improve your mental health. You can move your body. Exercise can relieve depression, possibly by altering the mood-regulating brain chemicals, norepinephrine and serotonin. It's recommended to exercise 3 to 5 times a week for 20 to 30 minutes at a time. And aerobic exercises such as brisk walking is the best, but any degree of exercise is better than none. Yoga has also shown to alleviate stress and symptoms of depression. Studies have shown that in both people with emotional distress and major depression, practicing yoga has reduced stress, hostility, and anxiety, as well as depression, and has shown improved energy, sleep quality, and well-being. There's also been promising research that suggests meditation may play a role in preventing relapses in depression. Get the feelings off your chest. Therapy teaches people about positive thinking and can relieve symptoms of anxiety and depression. A tool you can use is a mood diary, which is used to train someone to keep track of the positive things happening in their lives and not to let a single negative event wear them down. It keeps in perspective that good days do happen. Another thing you can try out are support groups, which are an excellent way to help treat mild forms of depression. These groups provide education on the disorder, a community of support, and the opportunity to learn from people dealing with similar issues. There are also many different therapies to test out. And as with many alternative therapies, there isn't a lot of data that proves effectiveness, but a handful of research suggests it might. For example, with the short, dark days of winter, some people are prone to a type of depression. And for this depression, light therapy may be beneficial. Other therapies you can try are acupuncture, which is said to stimulate certain body points and prevent and treat diseases, as well as regulate energy in the body. Another therapy is cognitive behavioral therapy, which is based on the fact that thoughts trigger feelings. Being aware of your thoughts and learning how to change your destructive thought patterns could alter the way your brain works and your reaction to different situations. Cognitive behavioral therapy is considered a short-term therapy and often lasts from 10 to 20 sessions. It has been shown to be as effective as medications in treating mild to moderate depression. Managing mental difficulties during the pandemic. There are some things everyone can do while practicing social distancing to help reduce the amount of anxiety and depression they're experiencing. Some ways we can all manage our mental health include making a friend, exercising, limiting time on the phone, making time to go outside, practicing breathing exercises, practicing mindfulness, and using support resources. So steps to minimizing mental health consequences of the COVID-19 infection. As Daijiro mentioned earlier, COVID can worsen your mental health and even cause you to develop a psychiatric disorder. These are some things you can do to minimize COVID's effect on you. First, you want to minimize your chance of even contracting COVID. Get vaccinated. This is especially important for people who already have a psychiatric disorder. You also want to continue to wear a mask and physical distance while maintaining your social connections. It's important to keep up with the CDC guidelines and state mandates, as protecting yourself from contracting COVID gives you the lowest chance of being affected by the infection. Structure aids in balance. Performing physical activity and making use of relaxing rituals can help you feel grounded. Physical activity, in addition to being as effective as medications on mood and anxiety, can also help with memory and heart health. And with the world feeling out of control, establishing a relaxing ritual and having control over part of your day can help calm you and re-energize you for those tougher days. You also want to watch what you ingest. Use caution with sleep aids and as-needed medications, as short-term use can quickly become long-term use, leading to medication tolerance, dependence, and rebound anxiety. It's also important to limit alcohol and cannabis use. Alcohol has already been shown to have detrimental effects on your health, but prolonged stress from caring for sick loved ones, unemployment, and increased time at home, as well as relationship stressors, can result in an increased and problematic substance use. You also want to be mindful of caffeine, as excess caffeine can exacerbate anxiety and sleep problems. During these times, it's very important to help others. COVID is affecting all of us right now. If you're worried about your health, it is more than likely that those around you are worried as well. Advocate for others. Those who have already been infected with COVID may not be in the position to advocate for things like workplace modifications, life insurance, or mental health coverage, especially if they are suffering from fatigue and brain fog. It's very important to check in with others. Ask how you can help your loved ones, friends, colleagues, and even neighbors. It's very hard to ask for help. It's much easier to turn down help than it is to ask for help. And if someone is primarily struggling with thoughts of suicide, a simple check-in call or kind gesture can be life-saving. It's also very important to make use of resources. In addition to mental health resources, there are online therapies, workbooks, and mobile applications available. Here are some solutions and tips for positive mental health, having a balanced lifestyle, and finding the facts from credible sources. The human mind is not the principal target of the virus, but it can very much be a collateral casualty. The support resources are both available locally and nationally. Nationally, SAMHSA's National Helpline is 24/7, and they guide not only individuals, but also families. The CDC has various lifelines that will support you throughout your darkest times. And locally, the Department of Health provides 24/7 support that will connect you to a counselor who will provide personalized suggestions on what your next steps may be. Waku Makani offers a COVID crisis counseling program, which assists both adults and children within our community with recovering from impacts of COVID, as well as any solutions to help anyone in a crisis. Remember in these times to be kind to your mind. Thank you for your attention. Any questions?
Thank you everyone for coming today. If there's any questions, please use the Q&A tab at the bottom of your window to enter any questions for our speakers. Okay, if there's no questions, thank you again, everyone, for coming today. Have a great rest of your week and happy holidays.